Hi everyone, my name is Dr. Chinmay Patkar and today we'll be talking about risk of development of other diseases with PCOS. PCOS or Polycystic Ovary Syndrome is a disorder primarily of the female reproductive system affecting females in the reproductive age group, that is after puberty. Due to hormonal disbalances, females with PCOS are at a higher risk of developing other disorders which can affect the quality of life. It is very important to understand PCOS, detect it early and understand the best way to control it so that you do not develop complications too quickly. Now let's deep dive into the several risk factors due to PCOS. Number 1 is type 2 diabetes. In PCOS, due to insulin resistance and because most patients with PCOS tend to be slightly overweight or obese, you are at a higher risk of developing type 2 diabetes. Also, in case if you have any family member who already has type 2 diabetes or has PCOS, it also increases your risk. Number 2 is any cardiovascular risk. Most times, patients with PCOS due to insulin resistance, due to overweight or obese characteristics or unhealthy lifestyle are at a higher risk of developing heart attack, stroke and blood vessel related disorders such as atherosclerosis. Especially due to the complications of PCOS, there is an increase in bad cholesterol, which is your low density lipoprotein, which is your LDL, which puts you at a risk of developing cardiovascular complications. Third thing that you're at a risk of being developed is the metabolic syndrome. Like I said, patients with PCOS tend to have insulin resistance, tend to be overweight, slightly obese, have a slightly unhealthy lifestyle. It puts you at a risk of hyperinsulinemia, which puts you at a further risk of developing metabolic syndrome, where you're slightly overweight, you have insulin resistance, you have a tendency to develop type 2 diabetes, high cholesterol, and can cause further problems and complications due to these scenarios. Number 4 is endometrial cancer. In normal menstrual cycle, the endometrium, which is the inner lining of the uterus, gets developed and shed with each month, with each menstrual cycle. Due to irregular and prolonged menstrual cycles that are seen in PCOS, this development and shedding does not happen properly. And sometimes, due to irregular clearance, what can happen is there can be a growth of abnormal cells inside the uterus, which puts you at a higher risk of developing endometrial cancer. Number 5 is obstructive sleep apnea. What is obstructive sleep apnea or OSA? It is when your breathing intermittently starts and stops during sleep. Especially due to patients with PCOS being slightly overweight or obese or having insulin resistance, have a tendency to have fatty tissue develop near their neck, which obstructs their breathing during sleep and causes complications of OSA. Because PCOS comes with development of all of these risk factors, it is very important to detect it early. And number 2, because it can be managed with a serious lifestyle modification in terms of your diet, in terms of your workout, and in case if there is any medical intervention needed in terms of hormonal therapy, it can be given and it can be controlled. You can rise above the problems and the complications, the risk factors of PCOS. Please get yourself checked earlier, please detect it earlier, get the right guidance. In case if you need any sort of help in trying to understand PCOS and what are the best ways to manage it, please reach out.